Good morning or afternoon to you students as you join Chapter 1, 21st Century Maternity Nursing for NUR 202. This is Miss Morris and I will be narrating your slide presentations. First of all, I need you to access the resources of the textbook in Canvas under NUR 202 and look at the key points and review any videos or questions listed in your resource for each chapter. These questions and key points will help you understand this class. Maternity nursing is not like the classes you have been used to taking and may be taking now. Maternity nursing is a specialty area, and if you stay engaged in the lessons and do the work assigned to you, we can do this, and I'm here for you. If you have any questions, I'm available by 2 different phone numbers, 2 different emails, and text messaging. Don't be afraid to ask me questions. There will be discussions on Zoom, and we will get through this. So hang in there. First of all, our objectives are going to be to describe the scope of maternity nursing, evaluate contemporary issues and trends in maternity nursing, examine social concerns in maternity nursing, explain risk management and standards of practice in the delivery of nursing care, discuss legal and ethical issues in perinatal nursing, and examine Healthy People 2020 goals that were related to maternal and infant care, because as you can tell, we're in 2020 now. So Healthy People 2030, I suppose, has already started, but we will be discussing Healthy People 2020 goals. According to your book on page 1, because of racial and ethnic diversity in the United States by the year 2060, they expected that about 43% of the population would be composed of non-Hispanic whites, resulting in that group no longer being the majority of people in the United States. Of course, this prediction may have been made premature because with the current pandemic and a lot of other things that could happen between now and 2060, those statistics may actually change. While morbidity and mortality are mentioned a lot in this chapter, morbidity refers to the level of health and well-being. Mortality is related to your risk of death. They are not the same thing. Morbidity doesn't necessarily mean that your ill health is immediately life-threatening. Over time, however, if an illness continues, it may increase your risk of mortality or death. Ethnic groups like African Americans, Native Americans, Hispanic, Alaskan Natives, and Asian Pacific Islanders experience the things that are listed here the most. This slide refers to a combination of things that lead to social determinants like lack of education and income associated with the differences in morbidity and mortality. Things like lack of transportation, lack of insurance, pollutions of different types, smoking, drinking, and illicit drugs or overuse of prescription drugs. They have a severe negative effect on mothers and their unborn children, which we will discuss in later chapters. The HRSA is working to eliminate disparities and improve delivery of health care for all people in the United States. The NPA has developed priorities to address and end health disparities. The IHI has created virtual training sessions on advancing safer maternal and newborn care. The NIH has committed to improve the health of minorities and provide funding for research and training of minority researchers. The NINR supports research that promotes health equity and eliminates health disparities. The CDC publishes reports and trends and more things than I can even talk about in a list here. If you go to www.cdc.gov, you will find that that is the best website ever to find out information about pretty much any disease process or anything that's going on in the world, especially affecting the United States. Very interesting website. The USDHHS, which is the U.S. Department of Health and Human Services, will provide evidence-based programs, integrated approaches, and best practices to reduce disparities. Healthy People 2020 was over a 10-year period. It's a national objectives here in the United States. If you look on page 3 in your books, box 1.2, and page 4, box 1.3, all of the details on these objectives and goals that were set by the U.S. government are listed there. There were 33 related to maternal, infant, and child health. And the United Nations Millennium Development Goals, which we don't hear about quite as often, there are 8 goals to be achieved by 2015, and I could look up some statistics on that if you want me to, or you could research and see if they met their 8 goals. Millennium Development Goals. If you look on page 4, box 1.3, of these 17 United Nations Sustainable Developmental Goals, you will see those listed there, and all are relevant to childbearing and child rearing. If you go to that website, there are 3 to 5 that are related specifically to women and infants. Integrative health care encompasses complementary and alternative therapies in combination with conventional Western medicine. The National Center for Complementary and Integrative Health is a government agency in the U.S. that supports research and evaluation of various modalities in these categories, and they provide information to the public and consumers about their choices. Chelation therapy is the last one listed. I think you may be familiar with everything else on the list. Chelation therapy is an alternative therapy used that consists of infusing intravenous substances to remove calcium and other heavy metals that may be in the blood and that harden arteries. See the next slide for more information. And on this slide, you can see that chelation therapy is a scientifically proven treatment for removing toxins from the body. And if you want to look up more, there's many websites that you can go to that will tell you more information about chelation therapy. Interprofessional education. If you look on page 4, box 1.4, it will tell you about the 4 practice competencies, which all of you will learn to use, if you're not already doing so, when you become a nurse. Teamwork and collaboration will be essential, and I think you're probably familiar with the S-bar already. Table 1.1 on page 5 shows you the S-bar in detail if you have not already memorized it. Problems with U.S. healthcare delivery. There is too much to discuss on this subject, but our healthcare system is certainly in need of some work. We all know that. The structure of the system does not work for many of us in the United States. Medical errors are the 3rd leading cause of death in the U.S. Giving too much medication, giving the wrong medication, giving it to the wrong patient, or simply omitting it and not giving it at all can kill patients. You will complain over and over about how many times we make you check meds in your simulations and at the bedside, but I promise you, you will not regret it if you ever catch yourself before giving something to the wrong patient, for example. There is a lesson we teach you these things for a reason. Healthcare is expensive and some can still not afford it, so hopefully the government will come up with a solution soon. You can read more about this on pages 4 and 5 in your book. Health literacy is important because at many of the facilities you may work in Jacksonville or anywhere else around the United States, you're going to find a lot of people who are your patients who speak no or little English. Some speak no English at all. So if they can't speak English, that may go to say that they can't understand English either. They may smile and nod their head a lot, but are they really understanding what you're teaching them? If we do discharge teaching but the patient cannot speak or write English, then have we really taught them anything? The CDC has a health literacy website. It is www.cdc.gov/health literacy. And this highlights implementations of goals and strategies of the National Action Plan to improve health literacy. This was part of the Affordable Care Act under patient protection. In the hospitals and facilities that you work in, you may also find translatable machinery that you can move from room to room. There's an app you can get on your phone to help translate when you're speaking to someone who doesn't speak English, and vice versa. So find out what the means are at the facility you work at. Trends in fertility and birth rate, low birth weight and preterm birth, international infant mortality trends, maternal mortality and maternal morbidity are what we're talking about here on this slide. Under maternal morbidity, you see that obesity is listed. That can complicate pregnancies in that usually a lot of obese women already come into the pregnancy with physical ailments like diabetes or blood pressure issues. So that can certainly complicate a pregnancy, which we talk about in more detail in another chapter. But if you look on page 6, maternal mortality rates and reasons for death differ throughout the world. In the United States in 2013, the rate was 17.8 per 100,000 live births. The significant problem is the proportion of preventable deaths in this country because of lack of prenatal care. The 3 major causes of death in mothers in the U.S. is high blood pressure, pulmonary embolism, and hemorrhage. Your low birth weight infants constitute those infants that are 2,500 grams or 5 pounds 8 ounces or less. Contributing factors might include mothers who smoke, do drugs, or are suffering from anorexia, and those who are pregnant with multifetal pregnancies. Of course, those babies are bound to be a little smaller. Regionalization of perinatal services. In this area, we have what's called regional obstetric consultants, also referred to as the ROC clinic, ROC clinic. It's for high-risk maternity patients. Maternal fetal medicine specialists work in collaboration with obstetricians and other primary care providers to provide care for high-risk pregnant women through consultation, co-management, and direction of care before preconception and during and after pregnancy. In ambulatory care for prenatal patients, the faculty must distinguish between basic care patients and high risk and make appropriate referrals. Genetic and preconception counseling, as well as electronic fetal monitoring during labor, has been the norm for many years now. Using telehealth is an umbrella term for the use of communication without having to visit your doctor's office. This can be very helpful when patients live a long way from the provider, have transportation issues, or are in a crisis like a pandemic where, like we're currently experiencing, that need to distance themselves from other people. Social media allows people to create a dialogue on the internet to share and exchange content. Community-based care, institution to ambulatory or home care setting. Trends in rural areas are trying to be more community-centered, where nurses provide care in homeless shelters and in schools, like to pregnant teenagers. Dependent upon what part of the country you live in and what kind of insurance you may have, or whether you go with a midwife group or physician, midwives are considerably less expensive, and some do home deliveries, encourage relaxation without pain meds, so you can defer having your epidural and just do it naturally. You can have water births, and there's all kinds of interesting alternative therapies and treatments that they use to get you through birth at home, as long as you are healthy and the baby is healthy. This slide shows a father actually catching his baby that's being born. She actually cried before she was completely out. Crying usually equals pink. We want to see pink in a baby when they're born, so crying is a good thing. And everybody looks happy except the baby. Involving consumers, self-management, and international concerns like female genital mutilation. Female genital mutilation, or female circumcision, is a ritual cutting or removal of some or all of the external female genitalia. This practice is seen in Africa, Asia, and in the Middle East. Infabulation is the practice of exercising the clitoris and labia of a female and stitching together the edges of the vulva to prevent sexual intercourse. It is traditional in some northeastern African cultures, but remains highly controversial. Human trafficking, this is the trade of humans forced into labor, sexual slavery, or for any other purpose where they're being held against their will. This may include forced marriages or the extraction of organs or tissues, including being used for surrogacy and ova removal against your will. Women's health topics. These topics will be discussed in a later chapter, but remember that we must screen all prenatal patients for these because it makes a difference in their care and how closely they must be monitored throughout their pregnancy. If cancer is discovered, for example, after a woman becomes pregnant, she may have a decision to make about cancer treatment or continuing the pregnancy. Some forms of cancer feed on the hormones that are being produced during pregnancy, and they may grow rapidly during the pregnancy, and she's gambling with her life, especially, maybe the baby's life too. All teenage pregnancies, remember, must be considered high risk, and usually women over 35 can be considered high risk also. Domestic violence often does not start until a woman gets pregnant, and with all the stresses of changes in the couple's life, the partner becomes overwhelmed and domestic violence then becomes an issue. Institute of Medicine Assessment and Transformation of Nursing Profession. When you become a nurse and decide to go into a specialty area, you will receive extra training in that field of expertise. Your scope of practice then will grow to include everything you will learn and be trained and certified to do. Get all of the training that you can and be careful not to do anything that you are not trained to do and be practicing outside of your scope of practice. You can lose your license for practicing outside of your scope. So stay inside the lines, get all the training and expertise that you need to extend your scope of practice. You may also want to join nurses associations like the American Nurse Association and the Florida Nurse Association is a branch of that, and the National League of Nursing, and make your voice heard when it comes to legislation that governs how you practice as a nurse in your state. You do have a voice. Trends in nursing practice, nursing specialization, advanced practice nursing. Nurse practitioners and nurse midwives are all master's degree programs. You can usually find those around here at UNF or U of F or Florida State. Lactation consultants, I think you only need a bachelor's degree for that, but nurses who are in that specialty area can get certification for that relatively easily. Nursing interventions classification, see page 9 for more information about this list. Evidence-based practice is providing care based on evidence gained through research and clinical trials. Not all practice has been proven in trials or research, so as nurses we must use our best clinical judgment or critical thinking as the case arises. This comes with time and years of practice as you progress in your nursing career. Outcomes-oriented practice. The OASIS is Outcome and Assessment Information Set. NOC is Nursing Outcomes Classification and Global Perspective. That's where the World Health Organization comes in and gives you statistics around the world on these specific things that affect everyone. So the World Health Organization is a specialized agency of the United Nations responsible for international public health. It is part of the UN Sustainable Developmental Group. Education about what other countries discover is very important and can help the people in the United States survive and treat many disease outbreaks, and we can certainly learn from each other, especially in a crisis time like we're in right this minute. Prevention of errors. The Joint Commission has a do not use list, which is in the table 1.3 in this chapter. It gives you 12, it's on page 12, and it gives you a list of JCO's recommendations, Joint Commission's recommendations for do not use abbreviations. Please look this over and be familiar. Usually the facility you work in will have a list on their med cart or posted somewhere in the med room of things that you are allowed to use and not allowed to use as abbreviations. Sentinel events are any event that's due to underlying conditions or natural courses of a patient's condition that affect a patient resulting in death, permanent harm, or severe temporary harm. These must be reported to administration and followed up to see what went wrong and how it could be avoided in future cases. Failure to rescue. There's an evaluation of quality indicators of nursing care relative to outcomes. Ethical issues, technologies, scientific advances, and informed consent. They now have the technology to do surgery on a fetus while the fetus is still in utero. Amazing things can simply be done now to help couples conceive when they never could conceive before. Informed consent must be done for any invasive procedures, and please do not forget that as a student nurse you are not allowed to sign as a witness on a consent form. Remind the doctor that you are a nurse student, that you will get the nurse in the room for them to be a witness. Reproductive technology, induced ovulation. Clomid or clomiphene citrate is an oral medication that induces ovulation by blocking estrogen receptors. This artificial anti-estrogen effect makes your body believe that estrogen levels are low, which stimulates the production of more follicle-stimulating hormone, and the Clomid acts as a fertility agent in women by inducing superovulation. That means the release of multiple eggs that happens before the menstrual cycle. In vitro fertilization is an assisted reproductive technology, commonly referred to as IVF, and is a process of fertilization by extracting eggs and retrieving a sperm sample, and then manually combining an egg and sperm in a laboratory dish. Then the embryo is then transferred, once it's fertilized, back into the woman's uterus. Multifetal pregnancy reduction is a controversial thing. It's a procedure where they reduce the number of fetuses in a multiple pregnancy, usually to 2. When pregnancy involves 3 or more fetuses, higher order pregnancy, the risk of miscarriage, stillbirth, and lifelong disability increase with each additional fetus. A woman who is HIV positive can take her medication throughout her pregnancy and lower the chance of her newborn having HIV to 5%, but the infant would still have to be medicated after they're born within 5 hours, and usually the meds they give the baby would be AZT or Bactrim. And hopefully this works if the mother took her medication throughout her pregnancy. And they would do serial testing on the infant every 6 months for at least 18 months to see if the infant converts to negative or not. There are activists for every subject, and embryo rights can be researched on your own time, as this is controversial and not one of our discussion topics. Cloning of humans, as far as I know, has not yet been approved in this country. I can't speak for other countries, but if they're cloning humans somewhere, they're keeping it hush hush. Innovations in allocation of resources. Intrauterine fetal surgery, we talked about. Fetoscopy is where they will insert the laparoscope into the uterus and look at the fetus for examination. Hopefully that's not done too often. Therapeutic insemination, genetic engineering, stem cell research, a very controversial subject also. They say that the stem cells are best from an embryonic stage of the fetus, which means if you abort the fetus, then they want the fetus to reserve stem cells for research, and that becomes controversial. Surrogate childbearing, that's where you designate another person, perhaps something wrong with your uterus and you can't carry the baby, but you have eggs and your husband has sperm, so they create a baby in a petri dish and then they implant it into a surrogate or another person. Usually a family member or a very close friend is chosen for this. Treatment of very low birth weight babies. Most of those babies can be perfectly normal. They're just under 2,500 grams, but they have everything they need to survive outside of the uterus. But some of them will be going through drug withdrawals and have other issues and end up in the NICU for an indeterminate amount of time. To assess a mother's risk of having low birth weight infants, the most important factor for the nurse to consider is which of the following? Is it African American race, cigarette smoking, poor nutritional status, or limited maternal education? As you look at these answers, a lot of you probably would just automatically pick cigarette smoking. In picking that one, you might be correct, but if you look at them all as a whole, they can all affect having a low birth weight infant. The key to answering this question correctly is Which of these is a non-modifiable thing? You can stop smoking. You can eat better, have better nutritional status. You can get educated, but you can't change your ethnicity or your race. African American women typically have smaller babies, and if they have other things that contribute to that, like smoking or drinking or alcohol, then of course that's going to magnify that problem. But the answer is A, because it is a non-modifiable thing. I hope you enjoyed and got something out of this slide presentation, and move on to chapter 2 now, and I'll talk to you soon. Thank you.